So we'll kind of get started. All right. So we're going to start off, of course, talking about COVID, and we've been going through the COVID pandemic for almost three years now, more or less. So just want to summarize. This is a communicable disease summit, so we had to talk about COVID. But really happy to see this chart. You can see that there's been a significant decrease compared to what we saw in January of 2022. We saw a couple peaks of cases. The biggest peak you see here and it's really associated with the Omicron variant. And that's what we're still seeing now. There are many different subvariants related to Omicron, but Omicron in general did cause that initial peak back in January 2022. During the first week of January 2022, we had over 25,000 new cases reported. You'll also see two additional peaks, much smaller, in late May and late July of 2022. But the good news is that the incidence and deaths continue to decline over the year. We are seeing a little bit of a peak around the holidays. It's no surprise. If you look at previous years, we saw a similar increase related to the holidays. We are seeing a post-Thanksgiving uptick in cases as well as hospitalizations. So even though Omicron and COVID in general we're doing much better, it's still out there. So we don't want people to be so fatigued, ignoring the fact that we are still dealing with COVID-19, and encourage everyone to promote safe holiday prevention strategies and also getting the bivalent booster. It does make a difference. There was new data coming out from CDC that has stronger evidence on the benefits of the bivalent booster for all populations, not just the elderly population. Of note, if you are following our community levels, we've been green in all three counties for a little bit of time, but recently we are seeing yellow, specifically in Kent and Sussex, related to increased hospitalizations. So just as a reminder, it is still out there. So please make sure you are staying safe as well as others. So again, here, January peak of 25,830 cases. That's related to the surfacing of Omicron, and then two mini peaks in May as well as July. This is just a summary of cases by age group. Since the beginning of the pandemic in April of 2020, the highest rate of cases have been among the age groups of 18 to 34, around about 4,000 cases per 10,000 population. Of note, the lowest rate is among the 0 to 4 years of age at about 2,000 cases. So again, here the highest rate, and then the lowest rate. So this is a good summary of how hospitalizations look like since the beginning of the pandemic for us, starting April 2020 to December 5th of 2022. You can see that there was an increase, and then there's a steady decrease going down, though I did mention that we saw a couple of bumps in hospitalizations around this time, again, associated with the holidays. As of December 5th, Delaware had 141 COVID-19 hospitalizations, with 16 listed as critical. Hospitalization has been tough to track. There are ups and there are downs, and our hospital friends out there felt the pain, as we all did, regarding how to manage hospital capacity, given that the trends of increases and decreases throughout this entire pandemic. The highest number of daily hospitalizations peaked at around 337 on April 27th, 2020. We were very concerned then, but then as we looked, there was even a higher peak on January 11th, 2021, with the current daily hospitalizations topping off at 473. During September 11, 2021, this was the Delta wave. There was a small peak with 271 hospitalizations. And then, of course, when we saw the Omicron surge, we reached 759 COVID-19 hospitalizations, and this was January 12, 2022, and this was our highest ever daily number. And then we kind of saw that there's been a decrease in hospitalizations we're very grateful for. For example, on August 9, 2022, you see 182 current hospitalizations. So we're hoping that we can continue to keep these numbers as low as possible, but we do need everyone's help making sure you're practicing safe infection control measures, as well as, of course, the bivalent boosters now out. CDC and FDA both have authorized the use of the bivalent boosters as low as the age of 6 months. We do want to kind of summarize our number of deaths, even though, as we mentioned before, the 18 to 34 years of age was the highest case rate. The highest rate of COVID-related deaths continues to be among people over 65 years of age. At the end of November 2022, Delaware averaged about 139 deaths per 10,000 population. The lowest reported rate is among 18 to 34 years old at 2 deaths per 10,000. So even though the incidents were in this population of 18 to 34, we still continue to see the highest death rates in the elderly population of folks over 65 years of age. Of note, we did not report death rates among children 0 to 4 and 5 to 17 due to some instability calculation with such low rates. So that's good news that the rates were so low that we could not really come up with specific numbers. Next slide, we're going to talk about test positivity in Delaware. This is the week of November 28th. 26 rather. Percent positivity has been very challenging. As you know, there is widespread use of the at-home rapid antigen test, which is great because we want to increase access to testing, but these results are not reported, so they're not calculated in our numbers. However, we do feel like that these numbers somewhat represent an accurate trend, with areas of highest percent positive: Newcastle County, Wilmington at 27.6%, Kent County at 10.6%, and Sussex County at 15.7%. Just sharing some numbers of vaccination, people with at least one dose. It just shows the incredible efforts and collaboration within the medical community. Appreciate everyone's efforts in getting the vaccine out. I still remember showing up at the warehouse at, I think it was 5 o'clock in the morning, when we were eagerly waiting for the Pfizer vaccine to come in, the monovalent vaccine. So, since then, we've had a lot of support getting vaccine into arms. And again, appreciate everyone's work on that and keeping our community safe. The age group with the highest percent vaccinated is those over 65 years of age. Again, you see the number 104.9%. We don't necessarily have an accurate number of the population as well as the elderly population. We do use an average. CDC may use census numbers. So that number is obviously not accurate, but with over 100%. However, it just shows that, we're doing very well with the elderly population getting at least one dose of the vaccine. Children ages 0 to 4 have the lowest vaccination rate, with only 7.8% receiving at least one dose. So some work still be done in the younger population, and really generally across the board, we're doing fairly well, but we can still advocate for the vaccine. Again, the highest rate, 65 years old, and then lowest rate in the younger population. Definition of fully vaccinated, again, it's just completing the primary series. It does not include booster or its eligibility. So, geographically, the highest rates of people who are fully vaccinated are in the following zip codes, as you can see here. Newcastle County, you have Wilmington, Hocassin, and Middletown. You have Kent County with Smyrna, Magnolia, and then Sussex County with Rehoboth Beach, Lewis, and Frankfurt. And as a reminder that the first COVID-19 vaccine was approved 2 years ago this month. So it's been a long ride here. But again, appreciate all the efforts and look at the good work that resulted from our collaboration getting the vaccine out into the communities. So the bivalent booster, we're not seeing as much of acceptance per se or administration rates. It was initially approved in September 2022. Around 43% people over 65 have received it thus far. Unfortunately, the booster uptake remains low, especially in the pediatric population. And again, just mentioned, CDC and FDA recently authorized the use of the bivalent booster for under 5 years of age. But we're seeing now only 1.5% of 5 to 11-year-old children have received the bivalent booster dose. But we're very excited to see that the 6 months to 4 years of age range now is eligible for the bivalent booster. But still a lot of work to do, especially in the youngest age groups. So highest rate, again, 43%, and lowest rate, 1.5%, 5 to 11 years of age. So looking how vaccination may be related to cases, this data covers October 31st and November 6th of 2022. During the week, Halloween week, there was a total of 911 COVID cases reported to TPH, of which 90% were not up to date on COVID-19 vaccination at the time they were tested. Again, as a reminder, the definition up to date means a person has received all recommended vaccines and boosters when eligible. For those that have recently completed the monovalent primary series, they may not be eligible for the bivalent until 2 months after their last shot. So just kind of keep that in mind. Doesn't mean that everyone must have a booster to be considered up to date. It really depends when you completed your primary series or when you got your last COVID shot. But again, just of note that, seeing these numbers, it does show that vaccines do provide some protection for severe burden disease, which may include hospitalizations as well as death. And going on to hospitalizations, during the same week, 94% of all hospitalized cases were not up to date on COVID-19 vaccination. So again, going along that approach that the vaccine does provide protection. Just looking at social vulnerability index scores as well as census tracts, according to the mapping of COVID-19 vaccination, looking at social vulnerability index, census tracts with the lowest rates of COVID vaccination and those that ranked highest for vulnerability are primarily downstate in Dover, Milford, Georgetown, and Laurel. Those census tracts you can see on the map are in the darkest green. These data have been helpful with us in trying to focus certain areas who are most vulnerable to COVID-19. So as you kind of look throughout the 2 years or 3 years, I should say, that there was approach from public health standpoint, how to identify locations to set up pods, vaccination sites, and so forth, and really appreciate our partners, especially in these areas, who've been supportive of getting vaccine to arms. Now, we'll go next section. We're going to talk about how COVID impacted other areas of public health, not associated with COVID per se, cases, hospitalizations, or death. So this was a major issue that was cited by CDC, that routine pediatric vaccinations were impacted, and we saw significant decline over the past year. Good news is we're starting to see some leveling, particularly in the diphtheria, tetanus, as well as polio immunizations. However, we still have ways to go with other vaccinations, and appreciate the medical communities providing pediatric care to continue to encourage routine pediatric immunizations. We all noted that there were decreases in those vaccines. So again, putting additional effort to get our vaccinations back up to where they were prior to COVID. But here's some examples of DTaP as well as the polio vaccine. Moving on to some of our HIV harm reduction services, we also see an impact there. We've also seen lower numbers in HIV testing. It decreased roughly about 50% when compared to pre-pandemic levels, although we are gaining some ground in 2021 and potentially 2022. We're also experiencing an increase in new HIV diagnoses. We were under 100 cases prior to the pandemic. We are currently at over 100 cases and climbing in 2022. I want to give a shout out to our Bureau of Communicable Diseases and our HIV Prevention Office, who collaborates with many separate agencies, around 15, that offer rapid HIV testing. So really appreciate the collaboration with those partners in making sure that we test those at highest risk for HIV. There are over 100 separate locations throughout Delaware where anyone can receive a free HIV test, condoms, and information on PrEP. It's very important that we link those diagnosed with HIV to care. Evidence clearly demonstrates that antiretroviral treatment significantly reduces the risk of developing HIV-related complications. So shout out to those folks there to continue the good work. Looking more in some harm reduction services, looking at our syringe program. Delaware continues to see an upsurge in those enrolled in our syringe service program and the number of syringes dispensed. Amazing number. Since 2007, over 1.6 million potentially infectious syringes have been incinerated and kept off the streets. Brandywine Counseling and Community Services, a shout out to them. They operate from 30 sites statewide. In addition to syringes, they provide other critical harm reduction programs, such as HIV and hepatitis C testing, distribution of condoms, offering of safe injecting kits, naloxone, and fentanyl test strips. In addition, the program has connected over 1,400 Delawareans to a substance abuse treatment center through a warm handoff process. The HIV Prevention Office collaborates with several other agencies that offer rapid HIV testing, including AIDS Delaware, Camp Rehoboth, and healthcare organizations like Planned Parenthood and Westside Family Health. Besides offering HIV testing, these agencies educate Delawareans about PrEP or pre-exposure prophylaxis. This afternoon, you'll hear more about PrEP. Talking more about HIV surveillance, in 2001, over 260 Delawareans were diagnosed with HIV, and 80 of those infections were from those who inject drugs, labeled in the chart as IDU. Over the past 21 years, we have fortunately experienced a significant decrease in new infections among injecting drug users and heterosexual transmission. However, what remained consistent over the last 20 years is infections due to men having sex with men. So moving on, we're going to talk more about some of our other programs within DPH, and also want to share some successes. COVID has been traumatic for many of us regarding what we experience as healthcare providers. However, I do want to highlight some positives, if I may. And one of the positives really looking at our surveillance systems, looking at our infrastructure, looking at our processes, and of course the additional funding. And really this additional funding helped us not only during the COVID-19 response, but also additional infectious diseases programs. And really the Healthcare Associated Infection Program, or HAI program within the state benefit from some of the funding that came about. So I want to give a shout out to the OIDE and the HIAC group, to really honestly be able to continue your good work during the middle of COVID, and really leveraging some additional funding to help reduce healthcare associated infections. So one HAI that we have seen in Delaware is the Candida auris. It is a nationally notifiable fungus that can cause invasive infections. It is very difficult to treat and can spread in healthcare settings due to its ability to persist in the environment. Hence, we're very concerned about outbreaks. Even though many states have had outbreaks in recent years, we've only seen a couple of cases prior to 2022. In 2022, we did identify 4 invasive cases of Candida auris, 3 of them in the blood and 1 in urine. The first 2 clinical cases in August and September sparked point prevalence surveys. We were able to work with our partners to get these surveys out, which consists of screening every patient in an infective unit to determine if Candida auris has spread non-invasively to other patients, thus becoming colonized with this pathogen. We together have performed 11-point prevalence surveys so far, which have identified 16 colonization cases in skilled nursing facilities, long-term acute care hospital, and a unit in a short-term acute care hospital. More point prevalence surveys are ongoing, and ages have ranged from 30 to 88 years of age. And most of these colonization cases have occurred in patients who have been in a healthcare setting for a long time. But again, the ability to perform these prevalence surveys really is related to improvement in processes and infrastructure related to COVID funding, as well as the great partnership we continue to have with the medical community to allow us to support these approaches to reduce infection, specifically with, in this case, the Candida auris. So part of the improvements we have within the state is we have increased capabilities to perform or conduct ICARs, which are infection control and responses. We have teams that go into facilities, perform direct observations, review policies, and then make recommendations to facilities for better infection control. This opportunity for education and sharing of ideas, expertise really is helpful in reducing spread infection within healthcare facilities. We're also working on adding Candida auris colonization and clinical cases to the statewide notifiable list using the CSTE case definitions. Another initiative that benefit from COVID funding is our antibiotic stewardship program that's related to our healthcare associated infection program. In addition to the Candida auris, carbapenemase producing organisms are another concern in healthcare facilities. This is related to antibiotic resistance, specifically to a class of antibiotics called the carbapenem, and they can cause infections and are difficult to treat due to their antibiotic resistance. Really appreciate the efforts within the state in antibiotic stewardship to really reduce unnecessary antibiotic prescription and use to reduce the resistance of pathogens. So again, this is an example of what we're doing to track multi-drug resistant organisms. So far in 2022, DPH has identified 13 confirmed cases of CPO infections or carbapenemase producing organisms. Just of note, the graph on the left, it reflects 14 genes because one case actually had 2 abnormal genes, OXA48 and NDM. Most have been the gene KPC or the gene OXAs. We've also seen NDM genes and the IMP genes, which are more rare in Delaware. Most pathogens that are impacted by these are seen in Klebsiella as well as Enterobacter. Now, of course, we have to move to TB. And again, I want to state my appreciation to the TB elimination programs, our public health clinics, and our partners to really think more about TB and also identify those at risk for TB, making sure they get screened and tested appropriately. And if they test positive, then they get the appropriate treatment. Just as a reminder, there are two TB-related conditions. We have TB infection, which is not infectious, and TB disease, which can be infectious, or another terminology would be latent and active TB. Fortunately, Delaware has a low incidence of TB disease. Since 2012, the number of cases of TB disease is usually between 50 and 20. The exception was 2021 when we did have that outbreak, which led to a total of 41 reported cases within the state, a majority of which was associated with the rare outbreak caused by contaminated bone graft material. And again, due to our partnership and the astuteness of our clinicians, we're able to recognize this source of TB and was able to really respond very quickly. We got CDC involved very quickly. They sent a team down to help investigate. It could have been much worse. And actually, the good work done by the state really reduced the threat within the country as this bone graft material was delivered throughout the country. So again, not only were Delawareans protected with our quick response, but also folks within this country. So good job on that response. Good news again, Delaware usually has a low incidence rate than the national average. You can see in the graph, the gray line is the national average and the red line is our incidence rate. We had that peak in 2021 again due to that situation. But as we move towards elimination of TB disease, the CDC did set a goal for the national incidence of TB disease. The goal is 1.3 cases per 100,000 people by 2025. Translated to Delaware's population, that means about 13 cases of TB disease per year. And you can see we kind of touch upon that. So there might be an opportunity for us to actually meet the national goal 1.3 cases per 100,000 people. But again, this won't happen if it weren't not for the expertise within the state and the collaboration we have with the medical community and the Division of Public Health. Despite the low numbers since 2001, Delaware has experienced a large outbreak of TB in the United States, or LOTUS, as an acronym. A LOTUS is declared when 10 or more cases of TB are reported in a 3-year period. They're genetically linked and related by recent transmission. So we are experiencing a LOTUS. Cases associated with the LOTUS are occurring in people who identify as white and were born in the United States. However, most cases of TB disease in the U.S. typically occur among people who do not identify as white and were born outside the U.S. The TB Elimination Control Branch is working closely with the CDC on strategies to stop ongoing transmission. Okay, as we move on, we're going to talk about rabies. Luckily, we will have an epidemic of rabies in humans, but we do have a problem within animals. Animal rabies cases are still prevalent throughout the state in all 3 counties. Very important for us to continue to educate the population how to protect themselves from exposure to rabies. The figure on the left shows confirmed rabies cases by year and species with the positivity rate. In 2021, the leading rabies vector species was the bat. However, cats and foxes are the leading vectors in 2022. The positivity rate is following the expected cyclic trend for animal rabies to cases. On the right is a map of the positive animal rabies cases in Delaware from 2021 to November 2022. As Delaware continues to grow and expand, greater human-animal exposures are likely. Rabies in humans is preventable with prompt medical care. If you need assistance determining whether an individual should receive rabies post-exposure prophylaxis or PrEP, please call the Office of Infectious Disease Epidemiology or ID for further guidance. But again, I think prevention is the key in reducing risk to humans. So continue to educate the public on how to reduce exposure to rabies is critical to controlling these numbers. Now we're moving to flu. We are in flu season, and it's unfortunately looking to be one of the worst flu seasons we've encountered in quite some time. For the past 2 flu seasons, Delaware and the U.S. experienced uncommonly low counts. Before the 2022 and 2023 flu season, influenza activity is elevated across the country. CDC estimates that so far this season, there have been at least 6.2 million illnesses 53,000 hospitalizations, and 2,900 deaths from flu. To give you an idea of how elevated flu cases are in Delaware, last flu season, Delaware had 2,794. 6 weeks into the current 2022 to 2023 flu season, Delaware had 2,047 laboratory confirmed cases. However, last week we had over 1,000. So we might actually be close to 4,000, even past 4,000 to main numbers. So we have seen a significant increase in weekly numbers. So again, keep that in mind that flu is a problem every year, but it's definitely a problem this year. So please encourage folks to follow infection control practices as well as getting your flu shot. The most common influenza subtype documented in Delaware is influenza A or H3N2, followed by influenza A H1N1, which aligns with the National Statistics updated weekly on FluView, which is publicly accessible on the CDC website. Delaware's influenza-like illness is currently at 2.77%, which is above the 2.1% baseline. So we are above average in flu spread, cases, incidents, et cetera. We've done a lot of work with flu. Again, I want to send kudos to the influenza program. We've put a lot of work into that, and really we took what we learned during COVID and implemented many of its approaches and practices into our flu response. So we now have a flu dashboard and toolkit as well. As flu cases have soared dramatically, it is time that in early November, DPH launch its flu dashboard on My Healthy Community. The flu dashboard will paint an accurate picture of flu activity among Delawareans by sharing weekly and seasonal data on positive cases, hospitalizations, deaths, and for the first time, vaccinations in the state. Updates occur weekly on Thursdays for local data and monthly for other geographies. Hopefully folks are familiar with My Healthy Community. This was our main public dashboard for COVID. And again, due to our experiences with COVID, we are using My Healthy Community as a way to share influenza numbers as well. So to visit the flu dashboard, you can click on the weekly flu data link at flu.delaware.gov, or you can go to myhealthycommunity.dhss.delaware.gov. And I'm hoping that everyone on this call or Zoom is aware of My Healthy Community. If not, please take a moment to look at My Healthy Community. It has a lot of great information, but specifically does have the flu information. And also I'm sharing the flu toolkit link. You can see on this on the slide, COVID materials, de.com, resources flu. And of course, we mentioned the general flu information website, which is flu.delaware.gov. Looking more into our total influenza case trends, we want to share the influenza cases by month between 2019 and November 2022. And you can see a significant increase in 2022. And it's again, very early compared to the peaks you have that we saw in prior years. After national COVID-19 emergency was declared in March 13, 2020, Delaware's influenza cases declined significantly for 2 flu seasons. Delaware's influenza-like illnesses and confirmed flu case counts align for the 2022-2023 flu season, and a steady increase is substantial. Along with influenza, Delaware is now tracking RSV cases as other respiratory illnesses are circulating, causing pediatric illness statewide and nationwide. The rise in flu cases comes amid concerns of a possible triple-demic. Hopefully you guys have heard of this in the media, the combination of COVID, flu, and respiratory syncytial virus cases. Of note, RSV is typically noted to be a pediatric illness, but we have seen adults getting sick with RSV and also being hospitalized for RSV. So really think total population regarding RSV. One public message we've been pushing is that, we're glad to see people are testing, testing for COVID if they have flu-like symptoms. And however, if they test negative, doesn't mean it's safe to go out and to go into public or go to work. There are other diseases out there. So think about flu, think about RSV, think about other winter viruses that might be occurring at this time. Just a quick snapshot on how we're looking with RSV. Again, this is a chart of the influenza season regarding confirmed RSV or confirmed respiratory viruses activity as of November 26, 2022. We have seen 672 laboratory confirmed RSV cases. And you can see here, the red line is your RSV trend. And we did see that peak in week 43, which did impact capacity at the hospitals, specifically at our pediatric sites. But you can see that, that line has gone down versus your flu trend has continued to go up. At the beginning of 2022, 2023 influenza season, RSV did beat out flu. It surpassed the influenza weekly counts. The steep increase in cases did overwhelm the health systems I mentioned before, not just in Delaware, but also nationwide. This also OID considered how to improve the way we are tracking and monitoring RSV and other non-reportable respiratory illnesses statewide. We are again grateful to see that RSV numbers have gone down. We're seeing it nationwide as well too. However, the flu line is still continuing to go up. So in summary, the triple demic is very unpredictable, and we need to continue to encourage the public to get important immunizations, COVID, influenza, and also practicing infection control measures. We want to talk a little bit about wastewater. This was a hot topic during COVID-19 as a way to survey how we're doing with COVID. Wastewater surveillance has been in existence for quite some time and could be used for other things, including other diseases as well as contaminants, chemicals, et cetera. As clinical testing for COVID-19 declines, there's some evidence that we can predict early surges in clinical cases with wastewater surveillance. Current literature states that there may be prediction power that ranges from 1 day to 3 weeks using wastewater surveillance data. It can also be used for underreporting of active cases in the community. Delaware has 12 wastewater treatment plants participating, 4 in Newcastle County, 1 in Kent County, and 7 in Sussex County. And we are encouraging the other plants to join in this program. The plants submit 2 samples weekly to the Delaware Public Health Laboratory, where viral load is determined. Wastewater results are uploaded to CDC's online National Wastewater Surveillance System or news at the link shown here. You can see it on the screen. OID evaluates the results, track wastewater trends, and develop linear regression code for potential surge prediction. This will help predict potential surges and help prevent potential false alarms in warning systems. DPH also continues to work on a plan that would identify thresholds at which actions or recommendations would be triggered and what recommendations or actions would be. So this is fairly new for us. And again, want to thank OIDE as well as the lab for making this happen. Again, part of the benefits or part of the lessons learned during COVID to allow us to use technology and science to expand our capabilities beyond COVID. So again, thank you for putting your work in to make this happen. So again, some trends you can see here. And you can see there is some correlation between the wastewater data and clinical cases. So there is an overlay of clinical cases for the entire county and wastewater results. And this is for Wilmington Wastewater Treatment Plant, which covers most of Newcastle County above the canal, including Newark and Wilmington. We see an increase in wastewater viral load prior to the clinical case surge around spring break in May 2022. Viral load in wastewater appears to align with clinical testing after the surge until November. In early November, we saw an increase with wastewater viral load, but not with clinical testing. This could be due to a microsurge that wasn't detected clinically, or it could be due to an artifact. But we can see wastewater surveillance data as being helpful in planning, mitigation, as well as response for potential peaks during the season. Finally, I'm going to give a shout out to OCOM for creating the Public Health Information Portal. This was launched on September 1st, 2022. This makes it a lot easier to find current public health issues that elevate concern instead of looking at individual websites. So kudos to OCOM for this. Good examples of where you can find current public health issues on this portal: COVID-19, Mpox, flu, other issues that may arise. So again, it's de.gov, public health alerts. This is a snapshot of what's going on within public health. You can find additional information on these topics on their individual websites. So for instance, COVID-19 information can still be found at de.gov, coronavirus. Mpox information can be found at de.gov, Mpox, and flu information can still be found at flu.delaware.gov. But again, it's a one-stop shop, so to speak, to see what current public health issues are going on. Just want to summarize about Mpox update as of December 7, 2022. We've had total 43 cases of Mpox reported this year as of December 7, 2022. More than 1,650 people in our state received at least 1 dose of the vaccine. As you can see on the CDC's graph, cases are trending downward, which is great news. CDC reported a total of 29,630 monkeypox cases in the U.S. as of December 2nd. Our neighboring sites have the following case counts. Maryland reported 733, Pennsylvania with 857, New Jersey 760, and Washington, D.C. at 524. We still only have one female case. Cases are primarily among adult men ages 18 to 34. 3 cases have been reported in the 50 to 64 age group. For more information, resources, including flyers, please visit de.gov. MPOX, but again, want to recognize Bureau of Communicable Diseases for the partnerships with several community partners to be able to spread the word of MPOX and to get vaccine into arms. So appreciate that collaboration there. 43 cases of MPOX in Delaware. So looking forward to 2023, a lot has happened over the past couple of years, and we're using what we've learned to improve some of our approaches and capabilities for next year. Again, providers are encouraged to sign up to receive Delaware Health Alert Network, DHON, notifications for updated public health information at healthalertde.org. Please sign up for this to get the most up-to-date information. We send information specifically to the medical community, so this is the best way to get that information, is being part of the Health Alert Network. Providers can access updated information on infectious disease and trends via Delaware's My Health Community. Again, if you have not seen this website, please look it up and be familiar with it. It will include other information that are not infectious disease related. So this is going to be our main portal to know what's going on within our populations. Once again, I want to thank all Delaware's medical providers, medical communities for all their hard work and dedication to the field. Please keep up the good work. I know we're all tired, but the work's not done yet, as we're seeing with our flu numbers in particular, the triple-demic that we're concerned about, other diseases going on that, our work's not done. And I appreciate everyone's cooperation during this time. And again, thank you for making time in your schedule to allow for my participation today.